Welcome to topic 3 of block 2. Having defined the activity to be evaluated, you need to operationalise the evaluation questions. In other words, you need to turn your evaluation objectives into questions which can be answered through the collection of data. Clearly, the questions asked must link to the purpose of the evaluation. In other words, will answering these questions provide adequate information upon which decision makers can act? What is it that the primary and secondary users need to know? Are there also primary and secondary questions? When thinking about what it is you want to know about the intervention, does this relate to processes, i.e. how it works, how it has an impact on outcomes, and whether or not there are any contextual factors influencing whether or not it works? Or do you want to know just whether it works, to measure what influence the intervention has had on various outcomes? Or is it a combination of the two that's needed? Also consider whether you need to compare outcomes in one group or setting to another. For example, do you want to know whether a certain group receiving a new talking therapy improve on a well-being score more than another group receiving the standard therapy over the same time period, or whether you just want to compare people's well-being scores before and after receiving the new talking therapy, without comparing to another group? While including a comparison group will increase confidence that any changes in outcomes are due to the activity being evaluated, and would not have had occurred anyway, time, logistical and budget constraints may influence whether or not this is possible. When you're specifying evaluation questions, be realistic and specific given available resources, and try to identify a number of key questions that you need the evaluation to answer to meet the primary and secondary user information needs. As a general rule, when specifying your questions, it's important to identify questions that can be answered with measurable and observable data. For instance, while it may be important to know if your intervention is influencing local health inequalities, how are you defining such inequalities, and what information would you need to know how to determine whether this is happening? Again, it's useful to look at your logic model when specifying the evaluation questions, because you've likely set up your evaluation to see whether the intervention influences planned outcomes, and/or whether the intervention is being carried out as planned. In the NHS Health Checks example, the primary users were the local CCG, who were funding the community service, and the main purpose of the evaluation was to decide whether or not to continue funding it. As a commissioner, key information needs are therefore whether or not it is having an impact on increasing health check uptake among underserved groups. A commissioner will also want to know, since they've outsourced the activity to another company, that they are delivering the health checks correctly, and therefore will probably have some questions around activity data. Particularly as some of the longer-term outcomes might be difficult to attribute to the intervention over a short period, users will want to know whether there have been any intermediate changes linked to expected causal mechanisms. For example, changes in the attitudes, beliefs or behaviours that are likely to be precursors or on the pathway to longer-term impacts. Another example is a study evaluating a hospital-based intervention to improve medication safety. Medication errors obviously increase the risk of harm to patients, so a scorecard was developed with staff from 2 NHS hospitals. This scorecard measures performance against a set of safety criteria, such as recording of allergies or prescriptions given without a signature. Medication safety data was collected on wards over 7 weeks, and medication safety scorecard use was fed back to staff. Performance, i.e. compliance or non-compliance with the scorecard, was also fed back to staff. What questions might primary users want to know? What about secondary users? The first thing primary users might want to know is how well the intervention is working. What questions would you ask to determine how well it is working? Firstly, you might think about whether there's been any change in medication error rates since the implementation of the scorecard. You might also be interested to know if implementing the scorecard activity has affected the way in which professional groups interact with each other, and also between one group and another group. To understand how well the scorecard is working, it would be useful to understand how people on the ground responsible for completing and those making use of the information on the scorecard view the intervention. Do they think it works? What barriers do they have to its use, and how might they improve it? As the intervention activity includes not just the scorecard completion, but also the feeding back of activity to staff, it's important to capture staff views and observations of those feedback sessions as well, in understanding how well the intervention works. And lastly, you might want to make a comparison to see if it tells you anything about how the scorecard intervention is delivered, and how that influences how well it works. To do this, you might ask whether there's a difference between wards or professional groups. To answer the question of whether or not the scorecard intervention should be extended to other wards or hospitals, and or to be adapted, you'll need to collect information not just on effectiveness and user views as already discussed. You'll also need to collect process data on how the activity is implemented and understand what time, staffing and other resources are implied by its implementation. The practical for this topic is to complete Performer Section B and identify which questions are needed to address the questions your evaluation is designed to achieve. We'll use one of the case study examples if you don't have a project in mind.